So thank you very much, James, for the introduction. It's really exciting to be here this afternoon and present this work, which has been going on for the last 4 years and has now been completed, notably by Belinda's defence. She flew through her defence on Friday, and we're very proud of her achievements. So she'll be Dr. Rose once the paperwork's done. But I thought I would sort of take you through the beginnings of this project. We're incredibly thankful to the TBA, to all the members here who, as members, have supported this work. It's not only allowed us to explore aspects of early pregnancy loss, but we have a lot of trainee veterinarians at our college. They come into our laboratories, work on associated projects, and we'd love to come back and talk to you about some of those other associated projects if you're interested in years to come. So we always have to start, I think, with who's involved, because we take a very holistic approach in our group in tackling these problems, particularly when they're difficult ones like early pregnancy loss. So in addition to Belinda, who's really driven this and made this possible, we've got a number of other people, notably an epidemiologist, Christine Verheyen at the college. We collaborate with a geneticist over in the States. And really importantly, the clinicians at NEH and Rostals have been absolutely critical, both in their curiosity and their interest in wanting to make stud medicine better. And without their support, this is not possible. In addition to the stud farms, we've got 29 stud farms, so probably many of you in the audience have contributed data to this project, and we know without your trust with that data, this wouldn't be possible. So let's start with this. This is a picture on the top right here of a pregnancy that's failed that was submitted to the laboratory. So you can see the fetus here. This is around 42 days. So this is what they look like when they fail and they come out of the uterus. You can see the fetus, you can see the placental membranes at this early stage. And critically, this is a period where all these important physiological events are occurring, and then probably from about 65 days onwards, it just gets bigger and bigger. So it's not surprising that early pregnancy loss is sort of most common before 65 days. I think it's, how many people in the audience have seen a mare with a failing pregnancy? Lots, there's a few nods and lots of hands. So it's relatively common, I'd say it's a common condition. And the last study that was done in 2002 found that about 7.4% of pregnancies were lost in this period. So the most common period in which pregnancy loss occurs. And because I'm an experiential learner, I've got one brood mare, and would you believe my one brood mare has had an early pregnancy loss? And this is her subsequent offspring called My Psychiatrist, who is now getting very good at getting forth. So I know all about this condition myself. But what I think it is, there's lots of financial implications and also management implications in rebreeding these mares. So where did it begin for us? Well, we had an undergraduate student, Lauren Hampstead, actually start working on getting some preliminary data. So when you design a project with something that's quite complex, we wanted to get some data together to understand how we could best design our questions. And what she found was that about 80% of cases of early pregnancy loss, we have no idea why they failed. And this is quite substantial. I know there'll be many in the audience that are also frustrated by the 25% of late pregnancy losses where you have no sort of diagnosis. But this really is something we need to start to make some headway with. The other thing she did, going through lots of records, including Sydney Ricketts here and James Crowhurst at the practices, was try and understand how they present. And what we found is that in 60% of the cases of early pregnancy loss, they're empty. So I'm sure there's lots of people in the audience, whether you're managing a farm or working with the mares day to day, you often and most commonly find these mares present as empty. And this can make it really difficult to study. So this brings me to the first approach we were using in this studies, which is called epidemiology. So essentially we've used a data-driven approach where we collect lots of information about the mare, the stallion, its surrounds, to try and understand underlying risks for early pregnancy loss. The second thing we found was that about 25% of these presented as collapsing or with no heartbeat. So what does that mean? When the vet puts a scan in, they don't find an empty uterus, but they actually find some sort of conceptus material in there. And that was also encouraging to us because it meant that we could potentially get that and start to study it and try and understand what's actually causing these pregnancies to fail. So that was really the second thing we've done as part of this project. Is Belinda's already published this work, is actually obtaining these, isolating them. The clinicians and the farms have been very busy submitting these, and we've developed new methods to actually culture them. We're not going to talk about that today because we don't really have time. We're going to focus on this first question. And these are the 4 sort of main questions that we want to go through with you. And hopefully you'll find many of the answers that we've generated will be practical things that you can think about in managing your mares. And we look forward to sort of getting your thoughts on this too. So the first of these, I'm going to go through each of these separately, so I won't read them all out, but we're going to start with what is the occurrence of early pregnancy loss in other periods of pregnancy loss 15 years on. And the reason I say that, it's been about 15 years since the last study of the incidence of pregnancy loss in the UK, so we don't really know where we are 15 years on, and a lot's changed. So how did we go about doing this? And when I say we, I didn't do much data collection. This was really hard work. So Belinda and occasionally some undergraduate students too worked very hard to go through breeding records and clinical records. A number of stud farms that may be here filled out surveys for us, so we could get comprehensive information on 174 mares and 2,246 pregnancies, which were covered by 86 stallions. As I mentioned earlier, there were 29 stud farms, and this data came from the 2 practices, the local practices. Now, everything, it's absolutely critical for this work, everything that has an identifier, such as a mare name or a stallion name or a stud name or a vet name, is always given an identifier code. So all the data that goes into spreadsheets like this is just allocated a code, and so it's sets of data and populations that we're really interested in. So the first question is the incidence. Well, what we found is that 6.4% of pregnancies that were confirmed at day 15 were subsequently lost. Okay, so this continues to be the period, if you look across the different stages of pregnancy here, this continues to be the most numerous period in which they are lost. What I've put underneath here, we've put some confidence, what we call 95% confidence intervals. So you say, what does that mean? Well, what that actually means is that we can be 95% confident that if we went back and sampled these animals again, that the rates would fall between this range. And that's sort of important when we're trying to understand the implications of these results, because if you look back here at the 2002 breeding season results, which found 7.4% of early pregnancies failed in the embryonic period, you can see this sort of overlaps with this confidence interval, and so we don't really see, this could be just sampling differences between the 2 years as opposed to any real decrease in EPL. So it seems we've reached a reasonably stable rate of early pregnancy loss in this population. The other thing to take away is that we also found that 1.6% of pregnancies were lost in this small 3-week window. So if you look across, traditionally we've just followed them from 42 days to October, but interestingly, at least half of them are going at this period, really sort of reinforcing the need to, I think, do these scans at the 65 days, because you can actually pick up a lot of these losses in this period then. So how do these rates compare to different regions in the world? Well, you can see here that this is the UK figure. This is the most recent figure from New Zealand, and this is from the US. So you can see, if you think about those confidence intervals we showed, they're somewhat similar to the New Zealand incidence, probably a little bit lower than what's seen in the States, although these figures are a few years old now and haven't been updated. So the next question that we wanted to understand, alongside all these potential sort of understanding of the incidence, was changes in reproductive management over these 15 years. So I'm sure you're on the studs day to day seeing what sort of therapeutics and drugs that the veterinary surgeons and yourselves are utilising to maximise the efficiency of the mare. So we wanted to try and quantify this to understand where we are at the moment. And you can see here, if you look at the first line across the top here, we looked at estrus induction agents. So these are things like prostaglandins, domperidone, sulpiride, things that try and bring in the mares into estrus earlier, particularly like if they're in transition as well. And you can see these are reasonably stable in their use between 2002 to 2013-14, about 38% of mares receiving these medications. If we move on, though, to induction ovulation, so these are drugs that are administered to induce the mares to ovulate, we can see that 92% of mares now are receiving either Corylon or Ovuplan, so it's a very high uptake. Potentially, I guess, to reduce cross-covers, so from an efficiency perspective, although Belinda's got some interesting news about this as well. And covering treatments, another area where we're seeing a substantial increase is in covering treatments. So now we have 63% of mares, breeding mares, are receiving some form of covering treatment. So that could be variable from intrauterine antibiotics, things that act on the uterus to try and expel a fluid, such as oxytocin, or intrauterine lavage. And Belinda's going to talk a little bit more about that as well, about the potential benefits or how we can possibly maybe try and think of ways to better understand these conditions and have better case selection to manage that. So now I'm going to hand over to Belinda. She's going to take you through some of the risk factors for pregnancy loss. Thanks.
Where am I? Thank you. One of the big things with the project that we wanted to do was to first try and identify factors that were contributing towards pregnancy loss. So they were broken down into different categories, so mare-related categories, so things like age, her reproductive status, findings on the ultrasound exam, so whether or not there are any uterine cysts, uterine fluid, that kind of thing. Also factors relating specifically to the pregnancy itself, so if it was a multiple pregnancy, if there'd been a multiple ovulation, the size of the embryo. And then external factors such as the therapeutics that are used, so the drugs that have been given at various stages of pregnancy, stallion, the stud farm, the vet, the month of the cover, all these different things that could contribute to the risk of pregnancy loss. So when we broke that down, the kind of analysis that we did, we looked at about 27 factors in total, and the analysis that we did, rather than in previous studies, previous studies have tended to look at each factor separately, but that doesn't account for factors that have got an overlap. So things like mare age is obviously very closely related to mare status, with young mares often being maiden and older mares often being barren. So the kind of analysis that we did on this data is called multivariable analysis, and this allowed us to account for all those different factors all in one, so that we could see the exact contribution of each individual factor, all contributing towards the pregnancy losses. So what we found at the end of that is that mare age increases the loss, so as a mare gets older, for each year increase in age, the risk of pregnancy loss increases by 1.1, which doesn't sound very much in itself, but if you think that's over sort of, a 4-year-old mare compared to a 20-year-old mare, that obviously is quite a big difference. There's been quite a lot of studies that have looked at the effects of mare age and why it is that older mares are more likely to lose pregnancies. Some of the work was suggesting that it was the uterus, so an older mare gets changes in the uterus, which means she's less able to carry a pregnancy. But then studies taking an embryo from a young mare and putting that into the uterus of an older mare have shown that in the majority of cases, an older mare's uterus is actually fine and able to carry the pregnancies, suggesting that the problem normally comes from the oocyte or the egg itself, which obviously as the mare gets older, the egg is getting older as well, and there's more chance for mutations or problems to occur. Having said that, it does look like the uterus does still play some kind of part. We saw not so much mare status, but the number of previous foals she's had was related to the occurrence of pregnancy loss. So a mare that had no foals was, or a mare that had a foal or more, was 2.5 times more likely to lose a pregnancy than a maiden mare. And again, that was taking mare age into account, so it wasn't an age-related effect. And we also saw that uterine cysts increased the incidence of EPL by 1.7%. So both of these factors suggest with previous foals potentially some kind of scarring or changes within the uterus related to the pregnancy that mean it's less able to carry the pregnancy. With uterine cysts, we know that blood flow in the area of uterine cysts is impeded. So potentially if a conceptus sits next to the cyst when it fixes, it may be that it's less able to receive nutrition to be able to help it succeed. Equally, we don't know whether or not it's that the cysts are actually representative of a larger uterine pathology. So what we want to go back and do at a later date is try and quantify this a bit more. So looking at the size of cysts and the location of the cysts in relation to where the embryo fixes to see how much of an effect they're having and what kind of things are coming out of that, so that clinicians and yourselves can make a better decision as to whether or not to treat cysts that are found in your mares. In terms of reducing the risk of pregnancy loss, it's quite well known, obviously, small for age vesicles are at a risk of loss. And we found for every centimetre increase in the vesicle size at day 15, the chances of early pregnancy loss reduces by a factor of 4. So it is quite a significant change there. It's not to say every small pregnancy will be lost, but it does increase the chances. The second thing that we found that can actually help improve the risk of EPL and reduce it down is the use of ovulatory agents. So things again like Ovuplant and Coralon, as well as improving the timing of ovulation so you can better time your coverings, we also found that they're able to reduce the risk of pregnancy loss. There's a couple of reasons why we think this might help. Firstly, obviously, better timing is good in terms of making sure we've got fresh egg and fresh semen. But also, there's a few studies that have shown that ovulation induction agents are actually able to enhance progesterone from a very early stage. So from sort of day 0 of pregnancy, you get a sudden surge in progesterone, which then can continue for quite a few weeks. And potentially this increase in progesterone is able to actually support the pregnancy better and minimise the risk of losses. The other thing that these agents have been seen to do is actually improve the blood flow to the ovary and to the uterus. So again, by improving the blood flow, you're actually potentially nourishing the conceptus better. You're better able to provide it with nutrition and enrichment to be able to support its growth through this early period. Also just noting there, so obviously the covering medications, pre-estrous agents, so prostaglandins and all those kind of things, it is just worth noting that these things don't have any benefits in terms of reducing EPL, but they also aren't causing any problems in terms of loss. So we don't need to worry about that going forward, that these drugs are having a negative effect. And just at the bottom here, we just put a little example just so you can see how much these factors actually change things. So a 10-year-old thoroughbred mare that's previously foaled, had a uterine cyst and didn't receive an ovulatory agent is 104 times more likely to lose the pregnancy in the early stages than a 4-year-old maiden mare with no cyst and receiving an ovulatory agent. Obviously, the 4-year-old mare's at a very low risk, but it just shows how much these changes can impact on the risk of loss. And when people are looking at the amount of pregnancy loss they have on individual farms, it obviously is important to look at all these individual factors, because the age of your mare population, which of these drugs you're using, how many maidens and things you've got, is all going to have a big effect on what kind of incidence you're going to be getting on individual farms. This is just to illustrate the mare age effect a little bit more. So each colour sort of represents a different age block. And you can see that even for 4 to 5-year-old mares, there's quite a big leap in the incidence of pregnancy loss. The top number shows the loss between 15 to 42 days, and the bottom number between 42 and 65 days. And again, in each stage, you're seeing an increased risk of loss in each of those age groups. So that just sort of, illustrates that quite nicely. The next thing we wanted to look at was endometritis. As Mandi mentioned, 62% of mares are now receiving treatment at covering. 50% of those are receiving antibiotics. A small amount of uterine fluid as a sort of response to covering is normal, but it has been shown that 2 centimetres of fluid or more can have a negative effect on conception. We found in our study that only 10% of pregnancies had greater than 2 centimetres of fluid. So this doesn't quite match with the 62% of mares that are being treated, or the high proportion of antibiotics that are being used. And indeed, when we looked at pregnancy loss itself, only 5.7% of the pregnancy losses that we saw were actually diagnosed as having an acute endometritis. So it's not overly responsible, it's not overly causing sort of huge problems when you consider all the other factors that must be causing pregnancy loss. And it just gives us something to think about there in terms of whether or not there needs to be a little bit of sort of more selection in terms of which mares are being targeted at this covering therapies, and whether or not this sort of high level of antibiotics needs to be used. Obviously at the moment there's quite a lot of interest sort of internationally in human and veterinary medicine about the use of antibiotics and trying to minimise the use and improve the sort of case selection. So they just looked like one area where potentially we could just work to try and be a bit more selective in which mares are treated. Wanted also just to mention multiple pregnancies. In 2002, 10.5% of pregnancies were twin or triplet pregnancies, and in our data that rose to 16%. So it looks as though there is obviously an increase, but just so that people can be reassured as much as anything, there was no effect of twin pregnancies, providing they were successfully treated and appropriately managed in terms of further losses. So a twin pregnancy which was successfully reduced sort of between day 15 and 17 is no more likely to lose than a single pregnancy. And indeed, with the use of flunixin or phenidine, when this was given at the time of twin reduction, we actually found that the risk of pregnancy loss decreased by a factor of 3. So the use of phenidine definitely sort of seemed to have a big impact in terms of helping these twin pregnancies. Phenidine actually helps it prevents the synthesis of prostaglandin, which is released from the uterus. It can be released when the twin is squozen. Damage to the uterus or trauma to the uterus can release this prostaglandin, which then can break down the corpus luteum, so you lose your progesterone. So by blocking that pathway, potentially phenidine is able to help to maintain that corpus luteum and maintain a healthy pregnancy. So the next bit, because we'd sort of seen obviously that smaller vesicles were more likely to be lost, we then wanted to look at what factors are affecting the growth of the conceptus in the early stage. So this just shows we got data from 1,800 pregnancies with vesicle sizes. The individual points are sort of each different data, and then you can see the 2 lines. So the blue line over the top is the size between day 11 and day 35 of pregnancies which were kept, and the red line underneath is pregnancies that were lost. So you can see even from the sort of early stages around day 14, there's a difference in the size of the conceptuses which were generally lost compared to those that were maintained. And by the time you get to 34, it's quite a big difference between the 2 groups. So factors that we found related to this were the number of live foals that a mare had previously had. So the more foals she'd had previously, the bigger the vesicle was likely to be. And also, foaling mares were more likely to have a larger vesicle than a mare that was barren rested or maiden mare. The theory we've got behind this is that there's sort of a priming effect when a mare has a foal. So the more foals she has, the more nutrition, the more blood flow you get into the uterus. The uterine vasculature is getting larger and enriching, and a recently foaled mare, the glands, the vessels are all sort of ready to go. So you're getting more nutrition and more blood flow to the embryo in the early stages, providing it with a sort of richer environment to get this early growth. The other thing we saw is ovulatory agents, so Coralon and Ovuplant again, also help to improve the vesicle size in the early stages. Again, this could be to do, again, with the blood flow to the ovary and to the uterus, and again, it could be related to the early progesterone surge that we get in association with that. Finally, the thing that's quite interesting is the use of uterine lavage, so just with sterile saline at cover, can actually help lead to a larger vesicle. So antibiotics and oxytocin had no effect, but actually sterile uterine lavage, if you think about it, it's just sort of literally washing out the uterus, so it's getting rid of any bacteria, any debris that could be interfering with the embryo or providing a hostile environment. And just by rinsing that uterus out and diluting down any toxic factors, that's actually having a substantial effect on the growth of the embryo. And it might be, when we talk about the sort of use of antibiotics and covering medications, in cases where we're not too sure, it might be that uterine lavage is a good sort of compromise between overuse of antibiotics and still wanting to provide some kind of therapy at cover. Lastly, we also just looked at Regumate, which is obviously used a lot in problematic mares or if the small vesicle is seen. There's been a few studies that have suggested that Regumate can help improve the size of an early pregnancy. But we found, and more recent studies have all found, that it's not actually having any effect whatsoever. If you look at the graph in the bottom table, the blue and the red line between mares that were treated with Regumate and those that weren't are pretty much exactly on top of each other. So we saw no benefits of Regumate on the size of the conceptus at all. And we also saw no benefits in terms of reducing the risk of pregnancy loss. We do know it works if the corpus luteum, so the supply of progesterone from the corpus luteum from the ovary, is removed. In those cases it can work, but in those cases are pretty rare. And it seems overall in problematic mares and small vesicles we're not really having any benefits from using Regumate, unfortunately. So the take-home messages from this part of the work, as I say, the majority of agents used in oestrus induction, prostaglandins, that kind of thing, aren't having a detrimental effect, which is at least good to know. And again, multiple pregnancies is nothing to worry about. Ovulatory agents and the use of flunixin definitely seem beneficial for people wanting to try and do everything they can to reduce the risk of pregnancy loss. And as we mentioned, uterine lavage, potentially just to help clean out the uterus and sort of maximise the chances and maximise the nutrition for the early conceptus can help. Also in problematic mares, as I say, we are going to do some more work in terms of trying to identify exactly what it is about the cyst that can cause the problems, and if the location and size makes any difference. But in the meantime, if you have got a problematic mare, certainly considering the treatment of the cysts would seem a sort of plausible line to go down. In terms of where we're going to take this work now, so as well as a sort of look at furthering the risk factor work, as Mandi mentioned, the second part of the study was involved in actually taking away those conceptuses that had failed and looking at those in the laboratory to try and look for reasons why they may have failed and what problems were going on there. A lot of this focused on the genetics. And we actually found that 65% of the pregnancies that were lost were male. So this is that's obviously an embryo that was removed, and these are the cells that were broken down from it, and these are actually the chromosomes that we got from that cell. And you can see here, this is a male with one X chromosome and one Y chromosome. And we found 65% of our conceptuses were male. So it does suggest that there may be a predilection for male conceptuses to be lost in this early stage. In humans, that's definitely the case, and there's a known bias for male embryos to be lost in the early stages, possibly due to immune effects, so the maternal immune system actually attacks the male cells, but possibly also related to genetic effects of the male as well. So that's certainly one area we want to go forward to investigate further, and also looking at the genetics overall. Not saying necessarily that there's a bad or a good mare or stallion, but certain combinations might just be able to maximise reproductive success. So if there's a sort of faulty gene, by sort of choosing better case selection, we might be able to improve rates in problematic mares. We just wanted also to mention that we are having a meeting at Rossdale's on the 3rd, where we're sort of talking to stud farms and the vets again, just to discuss the ongoing work, both in the early pregnancy loss and also later on, sort of abortions occurring later on. So everybody's welcome to come along to that, or send any sort of suggestions or thoughts about that in, if they've got any sort of, if you'd like to hear more or have any suggestions for the future work. And yeah, that's everything otherwise. Thank you.
Thank you very much, Mandi and Belinda. It's just excellent work and lovely presentations. We have got time for a few questions. If I could ask both of you a couple. There's quite a big study in America of 3,000 pregnancies and looked at twin reduction, which suggested that the use of flunixin made no difference to the outcome of the singleton, which was a very big study, and many of us have based our work on that. So your findings are interesting because they are at odds of that study, which was done quite a while ago. And it's food for thought for us following that big study in America. And you didn't mention, obviously, Regumate does not affect the loss of early pregnancy loss, which doesn't surprise me, but did it assist conception? Did you look at that?
In terms of
if people giving
Regumate
from ovulation, did you look at that? Does that assist conception?
We don't have conception rates as part of this study. We are going to get one of the students to go back and look at, we only sort of included mares that had a day 15 pregnancy, but we're potentially going to get a student to go back, and then we can start looking at those stages.
Actually,
yeah, and definitely with one of the sort of theories with the ovulatory agents being the increased progesterone in that early stages, it might be that Regumate in the very early stages, sort of like you say from day 0, is actually more beneficial than later on.
It's sort of creeping in, that is, a bit from some managers, and it would be better the use of Regumate from ovulation in certain tricky mares, and it would be very nice to have the statistics to say Or it might help in a certain category, or it actually doesn't make any difference.
Yeah.
And, that would be really worth looking at.
Yeah.
There is a study done by Barry Ball a few years ago, and they looked at very early on giving progesterone straight after cover, and they only looked up to day 8 embryos. They flushed them out, and they found it had no effect on the maintenance of the embryo then.
So questions, yes.
Hi, I just have 2 questions as well, actually. One was foal heat. Did that affect it in any way?
Nope. So foal heat and days from foaling to cover had no effect. I mean, partly that's probably because of case selection. Only very few were actually covered on a foal heat. So out of 2,200 pregnancies, only 30 were covered on a foal heat. And it's likely that they were very sort of carefully selected. And then obviously the treatments to reduce fluid and covering therapies and things were probably managing that very well. But there wasn't any evidence there that there was a problem, or if there is, it's been well managed, so it's not something to worry
then
about.
my second question was just Corallon versus Oviplant. Was there any?
There was no difference between the two. So if you've got a mare that's receptive to the Corallon, then that's absolutely fine. Yeah, whichever preference sort of you want to go down.
Jenny?
Thanks. Interested in the comment about the size of the embryos, the vesicles that were lost, and I realise you may not have the information because a lot of thoroughbred mares aren't looked at day 1 and day 2 and day 3 after covering, but would you be able to make any comments on whether they were small for age or whether they were actually late ovulations, that possibly there could be some maternal recognition of pregnancy factor affecting their survival, or you not really know the exact time of ovulation precisely?
In terms of we've sort of tried to look at the timing of ovulation, but it got tricky because, like you say, they weren't necessarily all looked at, so we weren't really able to sort of make any comparisons with that. But it certainly looks as though the agent's having an effect itself rather than just being a timing issue. When we looked at the level of increase in the size of growth after being given ovulation agents, it was enhanced further than you'd expect for just being a slightly older vesicle. And also with the if you looked at the growth, obviously it was sort of in 2 periods, so it sort of went up steeply to start with, and then the growth slowed down a little bit after day 20, whereas the improvements with the ovulatory agent remained all the way through and enhanced it all the way up to day 34. So yeah.
Different. Thanks.
Yes.
Yeah.
We are giving one of our mares Regulate at the moment, so are we wasting our money by giving her? Because it's quite expensive, and the vet said do so.
As I say, certainly in some cases it's warranted. So if there's a particular reason why you think if the corpus luteum hasn't been found, or if you've got a particular reason to think that the corpus luteum has been lost. So for example, if there's been endotoxin release, so if she's had sort of a severe colic or something like that, you can get endotoxin release. So in those cases, certainly Regulate can help. But there really hasn't been any evidence to suggest it's helping in other cases than those ones when the corpus luteum isn't there.
Or if the progesterone is very low, if you test it and it is very low and you've got pattern and things, then...
Yeah, she's a 15-year-old mare that aborted her foal last year, so the vet suggested, after covering and checking her twice, heartbeat, etc., to put on Regulate.
So sort of, yeah.
She absolutely adores it.
It's one of those things where it's difficult because there's just so little that we can do once they're pregnant, and we know it's not doing any harm other than sort of, just expense and having to put it in the feed. But
right, thank you.
The one at the back then, shall we?
Is there anything more known about possible cause where there is a nice embryonic vesicle developing, nice size, and no embryo proper ever develops?
The likelihood, I'd say, would be that this is going to then come out when we start looking at the genetic work in terms of the actual oocyte that was ovulated. In humans, again, the majority of problems in the first trimester are due to chromosome abnormalities within the oocyte. So we're speculating that that's likely going to be the similar case for the mares, and that's an area that we're sort of going to be looking at over the next 3 years to try and really sort of tweak down to see if we can find the sort of genetic reasons why
Do you want one?
happening. Sorry?
Do you want one?
Yes,
Kind
please.
of.
Well, tomorrow I have to PG her, according to the owner, so if you want one, you have to come tomorrow to collect it.
Yeah, no, we'll be there. I mean, they're not that common, so probably out of the 50 we've received in the laboratory over the last 5 years, the ones that lack an embryo or little fetus is probably maybe 3 or 4 maximum, off the top of my head.
I think a study by Dirk van der Wal showed something like 4.5% in their study.
Yeah, so it would be around that what we're seeing when they come into us from the mares here.
Okay, we've just run over a little bit. There's going to be perhaps a little bit more time at the end, or to ask specific questions of the speakers over tea afterwards. So thank you again to both speakers. That was tremendous.